Hello everyone, I'm Dr. Gaurav Kharya and I work as a director at Center for Bone Marrow Transplant and Cellular Therapy at Indraprastha Hospital, New Delhi. Chimeric antigen receptor T-cell therapy, also called as CAR T-cell therapy, as you might have heard, has come up in a revolutionary way to treat various blood cancers, especially the B-cell ALL and also B-cell lymphomas. What is CAR T-cell therapy? CAR T-cell therapy is a way of making the T cells capable of identifying the cancer cell and killing the cancer cell. In the process of development of cancer, what happens is that these T cells, which are normally able to identify the cancer cell and subsequently kill it, in the process of oncogenesis, somehow this mechanism is lost and this leads to the development of cancer. Now, in chimeric antigen receptor T-cell therapy, we make these T cells competent to identify the cancer cell by putting an identifier or a marker on the surface of T cells, because of which they identify the cancer cell and then subsequently kill the cancer cell. Now, this is not enough, because these T cells have the capability of persisting in the body for a long time. So, once the cancer is killed, these T cells go into the memory, and subsequently whenever the cancer tries to come back, these T cells again get reactivated and kill the cancer. So it's sort of a living drug. Now, this therapy is currently approved in US and Europe. Almost 5 to 6 products are US FDA approved. But the downside of those molecules which are approved in US and US and Europe is that they are hugely expensive, and the average cost is approximately $500,000 to $700,000 US. Unfortunately, it's sort of unaffordable in our kind of a scenario. So we as a country are working towards bringing indigenous, cost-effective CAR T-cell solutions for various patients. You might have heard that one patient has successfully been treated and he's post 1 year after treatment for CAR T-cell therapy. That patient was suffering from DLBCL, which is lymphoma, and he received CAR T-cell because he was non-responsive to any form of therapy, and he's 1 year disease-free and is doing very well. Now we are also working towards bringing up indigenous, state-of-art, next-generation CAR T-cell therapy solutions for various patients in need through a startup which is called as Cellular Therapeutics. And our objective was to address the challenges of the existing CAR products in the market. So the existing CAR products has a limitation that first of all, they just identify one marker, which is CD19, and thus there is a possibility of the cancer coming back in CD20 or CD22 clone. And second problem was that these CAR T cells do not persist in the body for a long time. So we started working on molecules, on constructs which can identify more number of cancer cells and thus decrease the risk of relapse, and also they can persist in the body for a long time. So we have come up with some very nice, innovative, bispecific constructs targeting CD19 and CD20, and also CD19 and CD22. And also we have added some more co-stimulatory domains to this construct so that this CAR can persist for a longer time. Very soon we are trying to initiate our clinical trials, and hopefully subsequently we'll be able to take it to the clinics.